Nowadays, most of our cancer treatments for head and neck cancer are either through surgery or radiation therapy, sometimes both, and of course with chemotherapy added to that. In general, swallowing is affected by the treatment itself, causing damage to some of the surrounding structures that we use to eat and drink. Luckily, the treatments that we have nowadays are much more amenable to rehabilitation after the fact. And what we actually find is intervening early on with patients, helping them understand the typical side effects, the typical trajectory of what their recovery could look like after surgery or radiation therapy. And even during radiation therapy, helping them exercise those muscles so they continue to function after treatment is especially important with our newer treatment approaches. In general, I'm embedded in the thoracic head and neck multidisciplinary clinic, so it would be common for you to come in, see one of our head and neck surgeons, the radiation oncologist, as well as a medical oncologist, and myself in one of those visits. Oftentimes, I offer an examination at the same time as the radiation oncologist or the surgeon, so we can assess their swallowing function, their speech function, as well as looking at what their treatment plan could be. After that first visit, we usually set up follow-ups either post-operatively to start their rehab. If additional counseling is needed, we would do that before their treatment starts. And then if it's radiation patients I usually will do some pre-radiation counseling where we teach patients really important swallowing exercises to maintain healthy function. And then I'll do routine follow-ups with them through the course of their treatment, usually at the beginning, the middle, and in the end. And then we set up post-treatment surveillance follow-ups with swallowing testing as needed. That's the typical trajectory of care we give, but most of the time you'll either see me after your visit with your oncologist or at the same time if you're a new patient to Fred Hutch. Some of the additional things that we offer are strengthening programs for patients' lungs and their respiratory system. It's not uncommon for me to see patients who have unfortunately developed long-term difficulties swallowing and may be at prone of getting liquids or foodstuffs in their airway. And so some of the other roles that we play is to help mitigate potential pneumonia and problems with breathing from swallowing-related complications. And so I'll also work with patients on strengthening their lungs, strengthening their cough strength, their ability to project things out of their airway, so they have better sets of pipes on them as they continue to move forward in their recovery. To ensure that not only patients survive these treatments, but then have good functional survivorship long after their treatment ends is also a pretty significant and paramount concern, not only of their doctors, but of their rehab specialists as well. So I think with this population, just surviving isn't always enough, and I think functional survivorship is really where we're focusing our treatments and our rehabilitation efforts in general. Being at Fred Hutch Cancer Center offers me the ability to have a farther reach to offer patients supportive services that they need, whether it's social work or rehab counseling because they're struggling to motivate for rehabilitation, or we need a dietitian involved or a physical therapy team involved as well. I find it much easier and advantageous to get patients the care they need here on site with everything they might need, rather than trying to refer patients out to different places and different hospital clinics that I don't actually have any contact with. So not only is it a beautiful place to work and a great opportunity to build a program that offers a lot of comprehensive cancer rehab care, but it also gives an opportunity to really holistically give patients what they need and not just focus on the one thing we're targeting in therapy necessarily.